Let me tell you about a woman named Barbara. She was 60 years old, a retired nurse from Tennessee, and she knew enough about medicine to know that what she was experiencing was uncomfortable, embarrassing, and increasingly affecting her quality of life. For weeks she had been straining at the toilet. Nothing was moving. She felt bloated and heavy. She was exhausted in a way that she could not explain. And like most people dealing with this particular problem, she had told nobody. Not her daughter, not her doctor. She managed it quietly, in private, with the vague hope that it would resolve on its own. It did not. When Barbara finally mentioned it to her physician at a routine appointment 3 months later, her doctor's response surprised her. He did not dismiss it. He did not hand her a product recommendation. He asked her 12 questions. He ordered a blood test. He asked about her medications, her water intake, her movement patterns, and how long this had been going on. Because Barbara's doctor understood something that most people dealing with this problem do not. Constipation in adults over 65 is not simply a plumbing inconvenience. It is a physiological signal. And understanding what that signal is telling you is the first step toward addressing it in a way that is safe, informed, and genuinely effective. My name is Dr. Franklin, and today I want to have the conversation that Barbara's doctor had with her, the honest, evidence-based conversation about what constipation in seniors actually is, what the research tells us about why it becomes more common after 65, and what the science shows about the approaches that have been studied in clinical settings. Not to tell you what to do, but to give you the information and the questions that will make your next conversation with your own physician more productive than it would be otherwise. Before we go a single step further, I need to say something that I will repeat throughout this video. Everything I am about to share is educational information. It is not medical advice. It is not a treatment plan. And it is not a substitute for a conversation with your physician. Constipation that is new, persistent, severe, or accompanied by any of the warning signs I will describe at the end of this video requires a doctor's evaluation before anything else. Please hear that clearly before we continue. Stay with me through this entire video because the information at the end about warning signs is the most important thing I will say today. And it is the information that too many seniors never receive before a serious problem is discovered too late. Drop a comment right now. Are you over 65? Is this something you have ever talked to your doctor about openly? I read every comment and your honesty helps this community. First, what the research tells us about constipation and aging. Constipation is extraordinarily common in adults over 65, a systematic review, published in the Journal of Neurogastroenterology and Motility found that the prevalence of constipation in adults aged 65 and older ranges from 24 to 30% depending on the definition used and the population studied. A large multi-center epidemiological study published in Frontiers in Public Health, which surveyed 5,122 adults aged 65 and older, found a constipation prevalence of 17.6%, with rates increasing significantly with advancing age and being measurably higher in women than in men. What makes constipation in older adults clinically distinct from constipation in younger adults is its underlying complexity. A comprehensive narrative review published in 2026 in the journal Geriatrics formally proposed classifying constipation in older adults as a systemic geriatric syndrome, meaning that it is not simply a single organ problem but a condition with multifactorial causes, associations with physical decline and frailty, and contributions to broader adverse health outcomes. This is important for every senior and every family member to understand. Constipation after 65 is not simply the result of not eating enough fiber. It can be related to reduced physical activity, to dehydration, to changes in gut motility that come with normal aging, to medications which are among the most common and least discussed contributors, to neurological changes, to hormonal shifts, to underlying conditions including thyroid dysfunction, diabetes, or colorectal issues that require proper evaluation. The reason this matters is that addressing constipation effectively and safely requires understanding which of these factors, or which combination of them, is driving the problem in your specific situation. And that is a conversation that can only happen meaningfully between you and your physician. What the research shows about the biology of constipation in the aging gut, understanding why constipation becomes more common after 65 begins with understanding what changes in the gut with age. The muscular contractions that move waste through the colon, called peristalsis, become less vigorous with age. The enteric nervous system, the complex network of nerves embedded in the walls of the digestive tract that coordinates these contractions, shows measurable changes in function with aging. The sensitivity of rectal tissue to the normal signals that trigger the urge to defecate can become reduced, and the pelvic floor muscles, which play a critical role in the final stage of defecation, may lose tone and coordination with age in ways that make the process less efficient. Regardless of what is happening earlier in the digestive tract, a 2024 cross-sectional study published in Medicine, which investigated functional constipation in elderly hospitalized patients, identified physical activity level daily fluid intake, dietary fiber content, and medication use as the most consistently significant contributing factors in their population. The study noted that multiple factors almost always operate together in older adults, rather than a single cause being responsible. The Rome 4 criteria, which are the internationally accepted clinical diagnostic standards for constipation, define chronic constipation as the presence of two or more of the following for at least 3 months: straining during more than 25% of defecations, lumpy or hard stools more than 25% of the time, a sensation of incomplete evacuation more than 25% of the time, sensation of anorectal obstruction more than 25% of the time, manual maneuvers required more than 25% of the time, or fewer than 3 spontaneous bowel movements per week. I want to be very clear about something here. If you are experiencing what feels like stool that will not move, significant straining, or any sensation of obstruction, please discuss this with your physician before drawing any conclusions about the cause. A physical obstruction, whether from a structural issue or any other cause, requires professional evaluation. The biology I am describing relates to functional constipation, which is a diagnosis your physician makes after ruling out other causes. That evaluation is not optional. It is essential. What clinical research has studied in terms of non-pharmacological approaches? Now I want to share what the published research has examined in terms of approaches that do not involve medications. I'm sharing this not so that you will try these things on your own, but so that you can have an informed conversation with your physician about what the evidence says and what might be appropriate to discuss in the context of your own health situation. Hydration. The 2024 medicine study identified daily fluid intake as one of the most significant modifiable factors in elderly constipation. Reduced water intake leads to harder, drier stool that is more difficult to pass. The relationship between hydration and bowel function is well established in the gastroenterological literature. Adequate plain water intake at a level discussed with your physician given your individual heart and kidney health is one of the most fundamental aspects of digestive function. Your physician can help you identify the appropriate daily fluid target for your specific health situation. Dietary fiber. A systematic review and meta-analysis published in PMC in 2024, which covered studies from 1946 to May 2024, examined the effects of dietary fiber supplementation on chronic constipation in elderly populations. The review found that fiber intake is a traditional and clinically studied intervention for constipation, though the authors noted that the evidence in specifically elderly populations requires further study for definitive conclusions. The general clinical consensus supports adequate dietary fiber as part of bowel health maintenance, with the important caveat that fiber increases should be made gradually and always with adequate hydration, as sudden large increases in fiber without sufficient water can actually worsen symptoms in some individuals. Any significant change to your dietary fiber intake should be discussed with your physician or a registered dietitian. Physical activity. The multi-center frontiers in public. A health study found that lower physical activity levels were independently associated with higher constipation prevalence in adults over 65. The WHO study review cited etiological literature. Consistently identifies simple colonostasis from lack of physical exercise as one of the most common functional causes of constipation. In elderly people, movement stimulates peristalsis. Even gentle daily walking has a documented relationship with bowel motility. Your physician can advise what level and type of activity is appropriate given your specific mobility, joint, and cardiovascular health. Toilet posture. A scoping review published in PMC in 2024, which analyzed 42 studies on sitting versus squatting toilet postures, found that squatting may reduce digestive strain and enhance bowel evacuation, potentially benefiting constipation. Research published in the Journal of Clinical Gastroenterology, conducted by gastroenterologists at Ohio State University, found that 90% of participants reported less straining and 71% reported faster bowel movements when using a footstool to raise their knees above hip level during defecation. The biological mechanism involves relaxation of the pubrectalis muscle, which creates a straighter pathway through the anorectal junction. The same scoping review noted that for older adults specifically, individual factors including joint health and balance must be considered, and that ergonomic modifications should be individually appropriate. Discuss this with your physician in the context of your own mobility and health situation before making any changes. Abdominal massage. This is perhaps the most extensively studied non-pharmacological approach in elderly specific research. A narrative review published in PMC in 2023, which analyzed 33 clinical studies on abdominal massage and constipation, found consistent evidence that abdominal massage has measurable positive effects on bowel function in multiple clinical populations. A randomized controlled trial published in Neurogastroenterology and Motility in 2026 which studied 74 elderly patients with chronic constipation, found that abdominal massage significantly improved stool frequency, consistency, and quality of life scores compared to standard care alone. A separate randomized controlled trial published in the International Journal of Community-Based Nursing and Midwifery studied abdominal massage in elderly individuals and found significant improvements in constipation assessment scores. PubMed confirms that multiple randomized controlled trials have concluded that abdominal massage can be suggested as an independent supportive approach in constipation management in older adults. The specific technique studied in most of these trials involves a clockwise circular massage, following the path of the colon, beginning at the lower right abdomen, moving upward on the right side, across the upper abdomen and downward on the left side. This follows the anatomical direction of large intestine transit. However, and I want to be clear about this, abdominal massage is not appropriate for everyone. It is specifically contraindicated in individuals with abdominal hernias, inflammatory bowel disease, recent abdominal surgery, unexplained abdominal pain, or any suspected obstruction. This is precisely why the research on this technique was conducted in clinical settings with physician oversight. If you are interested in whether this approach might be appropriate for your situation, that conversation belongs with your physician or a qualified healthcare provider, not with a video. If you are still with me and finding this valuable, type the number 3 in the comments right now. It helps me understand who is watching. What the research shows about the gut-brain connection in constipation. There is a dimension to constipation in seniors that most people never hear about, and I want to share it because the research behind it is genuinely significant. Research presented at the Alzheimer's Association International Conference in 2023 found that chronic constipation, defined as one bowel movement every 3 days or more, was associated with worse cognitive function, equivalent to 3 years of additional aging. The researchers noted that this was the first study to examine the potential impact of constipation on the aging brain, and that it added to the mounting body of research connecting gut health to brain health through what scientists call the gut-brain axis. This finding does not mean that constipation causes dementia. The relationship between gut microbiome health, bowel transit time, and cognitive function is an area of active and ongoing research. What it does mean is that chronic constipation is not a trivial quality of life issue. It is a physiological state that is associated with broader health consequences, and that deserves the same attention and physician engagement that any other chronic symptom would receive. The warning signs that require immediate medical attention. I told you at the beginning that this was the most important part of this video, and I meant it. Please listen carefully. There are circumstances in which what feels like simple constipation is actually a signal of a serious medical condition that requires prompt evaluation. Do not manage these situations at home. Contact your physician or seek emergency care. Seek medical attention promptly if you experience any of the following alongside constipation or difficulty with bowel movements, blood in your stool or on the toilet paper. This includes bright red blood on dark, terry or maroon-colored stool, which can indicate bleeding higher in the digestive tract, severe or worsening abdominal pain. Cramping that is new, severe, or progressively worse is not normal constipation. A sensation of blockage that is complete, meaning nothing at all is passing, including gas, and that is accompanied by abdominal distension or bloating that is visibly significant. Unexplained weight loss occurring alongside constipation, a significant and persistent change in your normal bowel habits that has lasted more than 3 weeks without a clear explanation. Constipation that develops suddenly in someone who previously had regular bowel movements without a clear dietary or lifestyle explanation. Nausea and vomiting occurring alongside significant constipation. Any of these symptoms in combination require a doctor's evaluation before any home management approach. The research is unambiguous that colorectal cancer, bowel obstruction, volvulus, and other serious conditions can present with symptoms that resemble simple constipation. Early evaluation saves lives. What to bring to your physician. The most productive conversation you can have with your doctor about this issue begins with preparation. Here is what the research and clinical guidelines suggest you bring to that appointment. A description of how long this has been occurring and whether it represents a change from your normal pattern. A list of every medication you are currently taking, including over-the-counter products and supplements. Certain commonly used medications, including calcium supplements, iron supplements, some blood pressure medications, certain antidepressants, and several other common drug classes are well documented contributors to constipation in older adults. Your physician needs to see the complete list. A description of your typical daily fluid intake, your fiber intake, and your physical activity level. A description of any other symptoms you have noticed alongside the constipation, however minor they may seem, and the simple direct statement. I would like to discuss this openly, and I would like to understand what is causing it so that we can address it appropriately. Barbara had that conversation. Her physician identified that one of her blood pressure Medications was a significant contributing factor. He made an adjustment with her cardiologist's input. He recommended specific dietary changes. He discussed appropriate activity goals. And within 6 weeks, Barbara's situation had improved substantially, not because she had found a home fix, but because she had finally had the conversation she had been postponing for 3 months. The research on constipation in seniors is clear on one thing above everything else. It is common, it is manageable, and the most important step, the step that comes before everything else on this list, is the conversation with your physician that most seniors delay for months longer than they should. If this video gave you the information to have that conversation sooner, please subscribe. I make videos like this every week, evidence-based, honest, and built specifically for adults over 60, and leave a comment below. Has this ever been something you have brought to your doctor's attention? Your answer might be exactly what someone else watching today needed to hear. Take care of yourselves. I will see you in the next one.